Hello friends, today we are discussing about the Unani system of medicine and role of pharmacognosy in Unani system of medicine. So, understanding what are the basic principle of this system of medicine. Basically, Unani system of medicine it's originated in Greece and mainly the Greek philosopher Hippocrates was a person who first started and gave few information or knowledge about the system of medicine. However, you all know Hippocrates, he is the father of medicine and he was the first person who told us there is no kind of curse or superstition because of which a person is suffering, but there are many medicine which are available which can treat these sufferings, and there were he had many students who followed him and started practicing his teachings. So Galen was one of the person who follows Hippocrates, and he was one of the person who stabilized this foundation in the Arabic physician. In Arabic physician, one person that is Regis and another one is the Avicenna. Both of them they started constructing this whole system of medicine, that is Unani medicine. Now what happened that there was some kind of disturbance in those Arabic areas in during about say around 1000 to 7000 years ago, because of which these practitioners they started refuging at different places, and then they came to India, and that time we had the Mughal dynasty ruling our country. So what happened at the Mughal dynasty? They allowed this Unani practitioner to start practicing their system of medicine, and gradually in today's time it has become one of the most utilized system in our country. So Unani considers the human body to be made up of seven components, just like Sapta Dhatus are there in Ayurveda. Here there are the seven components which are the Arkan, that is element, Mizaj, this is the temperament, Akhlat, which means humors, Anja, which means organs, Arha means spirits, Tuvo means faculties, and Afal means the function, each of which has the close relation to the state of health of an individual. So here you can understand elements means like Pancha Tadvas, four elements in as per the Unani system. They are mainly earth, then we have the fire, water, as well as air. We don't have ether in case of Unani systems. So here we can understand this is a you can say combination of elements as well as temperaments as well as the basic humors. I will call them, we saw them as the three things: Arkhan, Mizaj and Akhlaq. So Arkhan is basically earth. Earth has the Mizaj to be cold and it is related to the blood. Air, that is light, so it is related to dry, and it is also related to the phlegm, that is putam. In the water, it has the nature of wetness and it is also related to the yellow bile. While fire, it is related to hot and it is related to the hot mizaj and it is related to black bile. So you can see that a hot nature is there in blood also. It is there in yellow bile also. Dry nature, okay, dry nature is there in yellow bile as well as black bile. Cold nature is there in black bile as well as the mucus, and wet nature is there in black bile as well as phlegm. I can say that blood is having hot and wet nature, yellow bile is having hot and dry nature, and black bile is having dry and cold nature, while phlegm or the sputum it is having wet and cold nature. So this is the basically humors. They are made up of different mizaj. which are combination of hot and dry or dry, hot and wet. Then it can be cold and dry or cold and wet. So here 8 different points, and when they mix together, we get the different humors. So basically, when there is a equilibrium in this humor, the person is fine. But when there is any disturbance in the person in this humor, then the function of the body get disturbed, because of which external entity of a similar temperament is going to the patient to bring back to the normal state of the health. Unani medicine believes in promotion of health, prevention of disease, and cure. So basically it says there are 6 essential things which is known as the Asabe Sitta Zaruriya. In the Arabic language, there are 6 things which have to be there in a person to say that yes, you are healthy. He has to get fresh atmospheric air. He has to be have a pure drink and food. He has to sleep properly, as well as when he is awake, he has to be enough active or wakeful. His expression should be proper, but it should not be excess, like it should not be a diarrhea like condition. It should not be having any constipation, or he should not be having any diarrhea. So there should be a retention as well as excretion. If there will be no retention, the person suffer from dehydration. Then physical activity and rest, person should do enough physical rest activity, but we should also take enough rest. So there has to be a balance. Same is the case with mental activity, like we should not overwork our brain. It leads to stress, but we should not underwork our brain so that we become very dull and our brain stops working properly. So all these 6 points come under the Asabe Sitta Zaruriya, which have to be followed for the healthy life as per the Unani system. For the treatment in Unani system, basically there are 4 points by which the treatment is done. First of all is the Ilaj bir Tadbir. This is the regimental therapy. Second one is the Ilaj bil Giza. This is the dietotherapy. Third one is the Ilaj bil Dava. This is the pharmacotherapy. And last one is the Ilaj bil Yad. This is the surgery. So the drugs here mostly are used, they are of plant origin. Sometimes mineral, animal products can also be used for the treatment. Patients are generally treated either with single drugs or by the mixture of drugs or by the compound drugs. There are two type of compound drugs used in the treatment of the disease. That is classical compound drugs, which are used for the 100 and 1000 words, and second is the patent proprietary compound drugs, which have been formulated by the individuals or institution as per their research and experiences.